There is a new FDA-approved therapy to fight the leading cause of skin cancer, melanoma. It's called Amtagvi, and the University of Chicago Medicine is one of the first 30 institutions in the country to offer the treatment.
Joining us with details, Dr. Daniel Olson, a hematology and oncology physician at Chicago Medicine. Great to have you here. When I was treated for skin cancer, the solution was to excise a piece out of me. Can you talk about how this groundbreaking therapy is different from that?
Yeah, so things have changed really dramatically for advanced melanoma in the last decade. Before 2010, we could only cure about half of patients with advanced or metastatic melanoma. And before then, we really relied on things like surgery, but things have advanced dramatically in the last 10 years. And we can cure about half of patients with standard immunotherapy. However, for the other half of patients who don't benefit from standard immunotherapy, we've not had good treatment options. And so this new treatment called tumor-infiltrating lymphocyte therapy, the brand name is Amtagvi or lifileucel or other names, is a new type of treatment. It's a type of immunotherapy, but instead of giving an immunotherapy drug that changes how your own immune system behaves, we actually remove a tumor, and inside that tumor are T cells, and T cells are the part of our immune system that can recognize and kill melanoma cells. But melanoma itself is very inhospitable to T cells, and so they don't always reject the tumor on their own. And so what this therapy does is we basically take the tumor out, take those T cells out, and then reinvigorate and grow them in the lab, and then give them back, say, from an original 100,000 cells to up to 1 billion cells. And then we reinfuse those back into patients. And so the process requires a surgery first and then a manufacturing period. And then we actually have to give conditioning chemotherapy to remove some of the T cells in the patient and make room for these new melanoma-specific T cells. And then we infuse those into a patient in the hospital and then have to give an immune stimulatory sort of hormone with it called IL-2. And it takes place over the course of about a week. And it's a short and very intense treatment, but we know about patients who go in to get it, about a third to a half of patients can get long-term control of their melanoma, which is far more than what we can do right now.
Wow.
And it offers the chance of long-term remission and even cure for some of these patients. So it's an incremental benefit, but it's really important, and it's great that we'll be able to offer this to patients.
Well, Dr. Olson, before we run out of time, I was just talking to a physician at the FDA about the technology. It sounds like this can be used to treat other cancers. Is that right?
Yeah, so this process, tumor-infiltrating lymphocyte therapy, works in other tumor types where the immune system can recognize those tumors. And so in tumors that happens, lung cancer, cervical cancer, and others, this type of therapy is being investigated, and we actually have clinical trials in that regard. So we think this is only the start.
Good stuff. Really exciting stuff. Doctor, thank you so much for joining us. Appreciate it.
Happy to join.
I'll climb on my soapbox real quick. My change in a mole was only discovered because I had shaved my chest and my wife noticed it. So for you men out there, especially ones with hairy chests, maybe occasionally take a good look underneath the hair, because that's how I found mine.